My name is Helen Marshall. For those who don't know me, I'm a research leader in the Robinson Research Institute, Medical Director of the Vaccinology and Immunology Research Trials Unit at the Women's and Children's Hospital and the University of Adelaide. I would like to warmly welcome you to the inaugural SA Vaccinology Update. Before we begin, I would like to acknowledge and pay our respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and we respect and value their past, present and ongoing connection to the land and cultural beliefs. I would especially like to welcome the Honourable Jack Snelling, Minister for Health, who will open the SA Vaccinology Update, and Associate Professor Naomi Dwyer, CEO of the Women's and Children's Health Network, and our two session chairs, Professor Maria Macreades, Healthy Mothers, Babies and Children Theme Leader of SAMRI, and Professor Justin Bilby, Professor of General Practice at the University of Adelaide. I would also like to thank all our excellent interstate and local speakers, especially selected for their engaging presentations and good looks. Please note Dr. Steve Chrisley, who was to open the evening session, is a late apology due to the Ebola public health response, but we're absolutely delighted that Naomi Dwyer will be stepping in and opening the evening session instead, and thank her for doing so at this late notice. I'd particularly like to thank and acknowledge our 4 SA Vaccinology partners, including the Robinson Research Institute of the University of Adelaide, the Women's and Children's Health Network, SA Health and the South Australian Health and Medical Research Institute. And last but not least, a huge thank you must go to Laura Spencer from the Robinson Research Institute, who has done an amazing job organising every detail of this event and with her efficient and calm nature. I believe Australia has the best immunisation program in the world, but there's still plenty of room for improvement, particularly in vaccine uptake of recommended vaccines for pregnant women and improving timeliness of immunisation for Aboriginal and Torres Strait Islander children. While some of you will be aware that we are transforming health in South Australia, why not take up the challenge to transform immunisation as well and lead Australia in having the highest immunisation rates and lowest incidence of infectious diseases, particularly for mothers and their newborn. Our strong partnerships within South Australia provide us with the opportunity to lead immunisation in Australia and internationally. So having said that, I'm now delighted to introduce the Honourable Jack Snelling, Minister for Health, to open the inaugural SA Vaccinology Update. Thank you.
Thank you very much, Helen. Good afternoon and welcome to the inaugural Vaccinology Update in South Australia. It's a great pleasure to welcome those from interstate to the city that was home to the great Frank Fenner and Barry Marmion. I'd like to acknowledge our host, Associate Professor Helen Marshall of the Robinson Institute, and when she gets here, Associate Professor Naomi Dwyer, the Chief Executive Officer of the Women's and Children's Hospital. I'd also like to acknowledge that the event's supported by the Women's and Children's Health Network, the University of Adelaide's Robinson Institute, SA Health and SAMRI. The introduction of smallpox vaccine in India met with initial resistance. The cow is sacred to Hindus, and the thought of being injected with the necessary cowpox was abhorrent. But the vaccination had the great good fortune to coincide with the discovery of an ancient Sanskrit text. The document claimed that when fluid from the pox of cow udders was mixed with blood in the arm of a man, he would be invulnerable to the disease, thus easing the conscience of many. Over 6 months, millions of Indians, most of them Hindu, were vaccinated before the document was proven to be a forgery, written on artificially aged paper by an expert on Sanskrit from the British Museum. Smallpox was probably the most frightening disease since the Black Death. At its height, it killed 1 in 12. Its battle scars left survivors horribly disfigured, and it was a common cause of blindness. To this day, it remains the only disease that humankind has successfully eradicated, and the 2 centuries war to achieve this makes for some fascinating reading. The record shows in particular scepticism about the efficacy of vaccination and about its dangers are not new. There's been substantial opposition since 1840, when the British government began providing vaccination free of charge. Such dissenters were the first to be called conscientious objectors, and they were led by the writer Laura C. Little, a name that seems prophetic in retrospect. The movement's publishing was voluminous, and they recruited many of the intellectual heavyweights of the day. George Bernard Shaw described vaccination as a filthy piece of witchcraft. And Alfred Russel Wallace, who was pipped at the post by Darwin in publishing on the theory of evolution, thought vaccination too dangerous a risk and that vaccination cannot be proved to have saved a single life. Such movements did more damage in terms of lives cost than all but a few of the very worst dictators. In his book Angel of Death, Professor Gareth Williams highlights some of the failures of public policy and communication. He makes clear that both sides of the debate were guilty of cover-ups, falsification of data and medical fraud. He's particularly critical of the heavy-handed approach to get children vaccinated that saw fines as great as a month's wages for labourers and factory workers, a period that saw a rapid not unrelated rise in support for the anti-vaccination lobby. Australia's immunisation program has in many ways been a victim of its own success. As the diseases we vaccinate against become rare, concerns about vaccine and their safety overtake concerns about the danger of the diseases. We don't tend to dwell on things we don't often see. In our ignorance of how bad things could be, we allow for the foregrounding of infinitesimally small risks. Type vaccination into Google and you'll soon find that the internet is awash with unfounded allegations and distortions against vaccines and vaccination. And we know that those who opt out are not only playing Russian roulette with the lives of their children, but risking the health of the entire population. While Australia's vaccine coverage rates for children are high, with over 90% considered fully immunised by the time they are 5 years of age, to provide optimal herd immunity, vaccine coverage needs to be maintained above 90% for most diseases. It's even higher for some diseases such as measles, where at least 95% vaccine coverage is required. Such targets will only be achieved by policymakers working closely with parents and providers. The story of smallpox not only stresses the importance of vaccination, but how good intentions can often be misplaced. It shows that the conversation about the risk vaccination poses against the risk of the disease is a crucial part of health consultation. It shows us the importance of a nuanced message and of a coordinated approach in which the people communicating are cognisant of the most up-to-date science. Events like this one are crucial as it brings together experts in both child and maternal health, the policymakers who shape our immunisation programs, researchers in vaccinology, and the people who deliver the immunisation program to their communities. I wish you all the best for today's conference and every success as you strive to eradicate disease. In welcoming our first speaker, I'd like to say that my training in science didn't progress far beyond lighting magnesium with Bunsen burners. But our family has many doctors, and my brother here today is a leading medical researcher, so neither nature nor nurture are to blame. As the Minister for Health, I'm the bit of the black sheep of the family. But we are all very proud of my brother Tom's achievements. In 2011, Dr. Snelling was awarded an inaugural Frank Fenner Fellowship by the NHMRC. He's currently a paediatric infectious disease physician and epidemiologist at Telethon Kids Institute in Perth, and will today present to us on immunisation in Aboriginal and Torres Strait Islander children and on the role of immunisation in closing the gap. It's my great pleasure to welcome back to Adelaide my little brother, Dr. Tom Snelling.